Hello, my name is Jo, and I'm a first-year doctoral student at the Graduate School of Asia-Pacific Studies in Waseda University, Japan. As the world's most populous Muslim country with over 229.6 million Muslims, Indonesia has a silenced sexuality education. In the Indonesian society, sex has long been a topic of cultural taboo, and there has been a general consensus that premarital sex is an immoral, unlawful, and deviant social sin. Another impediment to sexuality education is the religious perspective. The general public has prohibited all forms of sexual contact, including kissing, embracing, patting, hand-holding, and sexual intercourse by believing those are zina, that is, illicit copulation under Sharia or Islamic law. In fact, this is the public misunderstanding, since in Quran, zina refers to adultery. Nevertheless, although the cultural and religious contexts of Indonesia have deterred its youth from opening up a dialogue around sexuality or any type of sexuality education, the youth have been exposed to the ideas of Western, liberal, free sex, known as sex bebas, from the proliferation of popular mass media. This has normalized the notion of premarital sex among Indonesian youth, reaching the rate of premarital sex 42%. However, the youth's lack of understanding of safe sexual practices from the absence of comprehensive sexuality education has resulted serious health consequences to them, including unsafe abortions from unwanted pregnancies and the spread of sexually transmitted diseases. Aiming to increase the quality of education in Indonesia by protecting the health of students, Indonesian government has provided Usaha Kesehatan Sekolah, UKS, or known as School Health Program since 2003. The UKS program is composed of three concentrations: health education, health service, and healthy school environment development, in which the sexuality education instruction is a part of the first category of health education. Sexuality education, however, has never been a standalone subject, but has been covered in multiple subjects in a scattered manner over science, biology, social studies, religion, from either anatomical or religious aspects. Also, although local doctors from government-mandated community health clinics, known as puskesmas, have provided practical contacts on sexuality education by visiting schools, this is limited, since the doctors only visit the school once a year for 3 hours. But the 3 hours were primarily spent for student health checkups, leaving less than an hour for sexuality education teaching in practice. In order to improve the quality and coverage of sexuality education in Indonesia, various organizations have provided support with different approaches in cooperation with the government and schools. As the UN agency, United Nations Population Fund has maintained an advisory partnership with Indonesian government and provided policy support and strategic planning for all matters involving sexual and reproductive health. Another international organization, International Planned Parenthood Federation, has provided services and advocacy, especially by recommending Indonesian schools sexual education curricula. It also has conducted an in-depth legal review of Indonesian laws and how they impact on youth. Perkumpulan Keluarga Berencana Indonesia is an Indonesian branch of IPPF. It has promoted child and youth empowerment and access to quality information, education, and care. It has also spearheaded campaigns of increasing the youth access to contraceptives and outreaching high-risk groups including sex workers and LGBTQ community. Indonesian NGO Pelita Ilmu Foundation introduced a computer-based sexuality education program called DAKU that aims to help young people make better decisions about their sexual and reproductive health. Despite its success of enhanced youth safe sex behaviors and knowledge on the issue, the scale of program implementation is limited due to cost and lack of computers. Taken these together, if the status quo is to continue, sexuality education of Indonesia will continue to be limited, and physical and mental health consequences of Indonesian youth would persist from their lack of understanding of sexual practices. Thus, we suggest 4 policy alternatives moving forward. First, reforming school curricula. We suggest the Ministry of Education to create a new national comprehensive sexuality education curricula to provide more universal and regulated instruction on sexuality and reproductive health. This would alleviate the problems derived from the current sexuality education being taught across multiple subjects from anatomical and religious lenses. The new curricula must be taught according to different age groups for providing them with appropriate content as per the UNESCO's International Technical Guidance on Sexuality Education of 2018. For instance, instructing values and appreciation of sexuality to students in lower primary level, and instructing puberty phenomenon and natural feeling of curiosity in sexuality for students in upper primary level. It is also recommended to add sex-positive interpretations from major religions in Indonesia. For example, including accurate Quranic explanation on jina, representation of human body and sexuality by collaborating with the Ministry of Religious Affairs and Islamic leaders. Containing students' voices and experiences about their hardships regarding sexuality will be beneficial to make Indonesian education contents more practical and engaging to learners. Second, implementing teacher training programs. Our second suggestion is to implement teacher training programs to hone teachers with basic knowledge and pedagogical skills that match with the new comprehensive sexuality education curricula. The optimal plan is initiating mandatory teacher training at teacher academies for new sport and health education teachers and grant them certification after they complete the training so that they have the authority to teach the comprehensive sexuality education. To support the incumbent teachers, the Ministry of Education should hold teacher meetings to assist their understanding of new curricula and teaching methods and invite professionals from NGOs to help the teachers adopt innovative pedagogical approaches for instructing comprehensive sexuality education curricula as a form of in-service training. To introduce students with various themes around sexuality through engaging approaches, the Ministry of Education should jointly cooperate with multi-sector actors, including NGOs, to create supplementary materials. 3. Pilot program for monitoring and evaluation. Recognizing cultural and religious diversity and difficult geography of Indonesia, the third recommendation is to create a pilot program for the recommended curricula and teacher training program to provide sufficient monitoring and evaluation to determine the feasibility of scaling up the initiative. In doing so, it is recommended to select 3 to 4 school districts in different contexts for comparison. For example, select Urban Muslim Majority District of Jakarta and select Rural Muslim Majority District of Southern Sumatra and select Non-Islamic District of Bali. Since the Ministry of Education does not have technical experts, partnering with UNFPA and IPPF and collaborating with their experts will be necessary for data collection and observing teachers in the field as a part of monitoring and evaluation process. Upon conclusion of pilot program, technical experts from each school district should analyze their results and conduct a feasibility study. This will determine whether the new curricula and teacher training programs are feasible to be scaled up to reach more school districts, or they need further modifications. Lastly, for outreach for marginalized communities. For reaching a larger number of Indonesian youth who may still lack exposure to new comprehensive sexuality education curricula, our last recommendation is to continue outreach to marginalized communities through organizations and NGOs outside the formal education system in coordination with Ministry of Education and local governments. Targeted groups will include students with disabilities, LGBTQ community, and those in juvenile detention centers, and more. Especially for students with special needs who are audibly challenged and visibly challenged, and youth in juvenile detention centers, expanding a computer-based sexuality education DAKU would provide an excellent option for their learning. And for other high-risk groups, such as members of LGBTQ community or sex workers, who are excluded from the comprehensive sexuality education programs delivered in schools, it is important to continue PKBI's peer education and outreach programs of distributing contraceptives, education materials for sexual and reproductive health and counseling. Lastly, doctors and nurses of local health clinics known as puskesmas should be required to periodically visit villages, community learning centers, or individual households for many school-aged youth who are outside of the formal education system, including children in slums and children living on the streets. This way would ensure the youth equal access to sexuality education and potentially gain better awareness about fundamental rights to sexuality and condom or contraceptive use for safe sex. To conclude, although the existing limitations regarding sources of funding, transforming dominant cultural stereotypes, and scope of coverage may leave questions about the feasibility of four policy alternatives, Indonesia offers reasons for optimism. Past attempts at a national comprehensive sexuality education curricula were only derailed by conflicted regional interests nearly 2 decades ago. Moreover, with proven positive results from the pilot program, the Ministry of Education will have evidence-based justification for spreading this curricula to a truly national level and scope. Organizations such as the UNFPA, IPPF, and PKBI already have dedicated staff members to enhance the sexual and reproductive health of Indonesians and realize positive change in the future. Therefore, with their concerted efforts towards devising and monitoring a new school curricula, Indonesia will be on a progressive stride towards a healthier and more open sexual culture. Thank you.